Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it.
Welcome. Thanks for tuning in and enjoying another episode of Ask the Chiropractor. I try to come on, like I said, and answer questions about chiropractic care. Now, I'm going to talk about a condition, or maybe not a condition, but a situation that patients come in all the time, and there's a little bit of confusion on. They come in, they talk about their SI joint. They say, I got an SI situation. First, let's talk about what the SI joint is. S stands for sacrum, I stands for ilium. Sacrum is more commonly called your tailbone. It's the bottom of your spine. It's a triangle-shaped bone. When you were younger, your sacrum was 6 different bones. When you go through puberty, they fuse and form one bone. Now, the ilium is more commonly known as the hip. And so we're talking about the SI joint. We're talking about the joint that's usually right along your belt line and probably about an inch or inch and a half to 2 inches away from your midline. So right back there, right? Everybody points right back here. It bothers me. They'll point at it, they'll touch it, and they'll say, this joint's really bugging me when I walk, when I go to get up, when I climb stairs, it talks to me. I hear all different things about when it bothers them. Now, a lot of people actually come in and tell me their sciatic's out, and they point their SI joint because people get confused what's what. But that's your SI joint. Now, I've been a chiropractor since 2002. And we learned lots of different chiropractic adjustments and different evaluations, and I've learned even more since I graduated. And you go to the chiropractor, and the chiropractor almost always starts laying you face down, checking your SI joint. Now, how do we check your SI joint? We look at your feet. We measure your feet. So if you ever watch a video of a chiropractor pushing in the bottom of someone's feet, we're looking for a long leg and a short leg. And then a lot of times you'll see the chiropractor bend the knees up, so your feet are now pointing towards the ceiling, and we're remeasuring the heights. So what are we doing? This is called the Deerfield check. Dr. Deerfield came up with a way to analyze the hips and see what's going on. If you have a short leg and we bend your knees and that leg gets longer, we know that's probably the involved joint. We call that a PI joint, posterior and inferior. It's the way it moves, so we call that a PI. Now, when we have a PI, then we start looking to see which way, anterior superior rotation or inferior, which way did it turn, which way does it move. So that's the next part of it. But let's just talk about that side first. So if I take your leg and you're short and I bend your knees and your short leg is longer, I suspect it's that SI joint. If I bend your legs and your feet go even, then I'm thinking more it's just the sacrum. And if I take a short leg and I bend it and the leg stays shorter, then I just assume that you were born with a short leg. Now, we can confirm all this on x-ray. We take an x-ray analysis of your hips, and we can see if you have a long or short leg. A lot of times patients come in and tell me their doctors diagnosed them with a short leg. All they simply did was lay them down and see a leg was shorter and said, you have your short leg. Now, a short leg is a very common finding. Almost every patient comes in with it. But the question is it really SI involvement? So how do we know if it's really the SI involvement when we do that Deerfield check or not? So you come in, we lay you down, you have a short leg, I bend your leg, it gets longer. So now I suspect you might have something going on at the SI joint. One way I would know for sure is if I had an x-ray of your spine. With an x-ray of your spine, today we have computer software. When I went to school, we had to use a little bit of geometry, algebra, and stuff like that. We could actually do a mathematical equation based on the rotation of your hips and different landmarks to determine whether or not you have a short leg. This was done by Dr. Gonstead up in Wisconsin, on the state line here in Illinois, right across the border. So he was able to figure out a way to measure for a measured difference and an anatomically short leg. Now, the measured difference means that there's rotation going on, and the rotation is going on and showing up in the pelvis. Now, why would your pelvis rotate? Why would you have this misalignment in your pelvis? If you've listened to my previous podcasts, I always talk about the righting reflex, like left and right, the righting reflex. The righting reflex says our eyes stay level at the horizon at all times, so no matter what goes on our back, if we hurt our lower back and our body shifts to the right, then something else is going to shift to the left to bring us back centered again. If our eyes are not level, then we'll lose our balance, we'll have blurred vision, and we'll have slurred speech. So we'll almost come up looking like we've had too much to drink that night. So the writing reflex always self-correcting. One of the number one spots that usually gets involved in this is the SI joint itself. So if you lay down and we find that you have positive near field check, there's a reason to check out the SI. What I tend to then do is make a mental note of that. Make sure it's not your sacrum, just your sacrum. Begin by if you measure your knees and then bend them, and they go even, and I think it's your sacrum, not to hit the top both joints, just the one. Another way we can double check that is having you lift your leg without bending your knee. We'll make it higher than the other. Now we know it's the sacrum. So let's say it's not the sacrum. Let's say just the SI is going on. Do we immediately adjust the SI joint? I don't. I very rarely ever go to the SI joint. I usually save the SI joint to last because of what we talked about, the writing reflex. So I'll go ahead and look at your lumbar spine, your lower back. I'll look at your thoracic spine where your ribs are. Then I'll check your cervical spine, otherwise the bones in your neck. And then once all that's cleared out, I bring the table up and I have you take a couple steps and then come back on the table. I have you take a couple steps because I want to check the writing reflex. If you take a few steps and come back to the table, now you've recentered yourself innately to the writing reflex. So ideally, if I adjusted everywhere in your spine and your SI joint was tender because it was self-correcting with the writing reflex, after we're done, when you lay on the table, you should be straight again. And this happens more times than not. A lot of times I have patients that see me, usually from a younger chiropractor, and they've been putting their side and twisted a lot, trying to get that SI joint to alleviate because they say this is where it hurts. This is the chiropractor does a check to see if it's misaligned, and the chiropractor immediately starts going in with a very aggressive adjustment, trying to correct this SI joint. In reality, this SI joint was never the problem. The SI joint was simply counter-rotating to balance off maybe a problem all the way at the top of your neck. Last week we talked about concussions and how it could affect the top bones in your neck. It's very possible to have a concussion, have a pelvic misalignment to balance out the damage that was done on top with the writing reflex. So like I said, I wait to the very, very end to check the pelvis. Now, if I do all that and you are still showing positive tests, then we start off with the one adjustment, but the table makes a popping noise. Maybe you've been at the chiropractic table, you've heard the table pop. What is that? Isaac Newton taught us an operative motion will stay in motion until it's acted on by outside forces. So if I grab your SI joint and I try to separate the I from the S, I try to get on the ilium, try to put a little torque on there and then slam the table down, in theory, the joint will slide into place and all of a sudden the table comes to an abrupt stop and then it goes into place. So it's not like when you hear like a chiropractor that does those and you hear the popping noise. This is more of a mechanical assisted adjustment using the table. Most patients tell me they don't feel next to nothing when they use adjustment. They're like, did you even do anything? Matter of fact, when I went to Palmer College, I got guilty of that. I told them to see when you go to Palmer College, you have to get adjusted by other students because the other students have to do so many adjustments in order to graduate. So when I showed up and I'm a son of an alumni, which means I get to go to the clinic at no cost, my neighbor asked me to come see him because he needed the credits. So I went to get adjusted and he did that little pop to me. And I remember telling the professor, come on, give me a real adjustment. Now, what I did not know at that time was that professor actually taught that class. And I got quite an earful, quite a lecture that day. I wasn't even enrolled in Palmer yet. I had just gotten accepted. And I already was put to work having to sit there and observe these adjustments and learn about this adjustment even before my first day as a student because I opened my big mouth too soon. So this adjustment's meant to free that joint up. Now, my personal opinion, I find this adjustment works very well if the SI joint was counterbalancing for something else. If the SI joint itself was actually the problem, actually was a fixation, then we do a more aggressive adjustment. Now, you can always go backwards. You can always start off light and get more aggressive, but you can't get more aggressive than go light. So if I do those 3 drops and you're still off, then we'll do a more aggressive adjustment, knowing that's probably the actual fixation. Now, who typically has the actual SI fixations? Or usually someone that had a physical trauma done to them. I take care of the hockey team, right? So they have this a lot, but playing hockey. But if you're just having an office job every day, commuting back and forth, I imagine the SI joint pain is probably more referred from somewhere else. Where if you're a soccer player and you're running around kicking and jumping and twisting a lot, then I think it might actually be the SI joint. Now, people have proven me wrong in both cases, but that's typically the clinical finding that we see. So if you're an athlete or you're doing a lot of physical activity, even if you just go to the gym every day and work out, there's a good chance your SI joint might actually be stuck. But if you're feeling pain down there and that's not your lifestyle, there's a good chance something else is going on. So it's good to go get checked. Now, if your doctor You talked about having the short leg and the long leg. If your doctor ever tries to give you a insert to your shoe without taking the x-rays and actually doing the measurements that we do, there's a good chance you're going to make that SI joint worse. Because if your leg came up because your pelvic is rotated and you put a lift under the leg that came up, that lift creates an upward pressure, not a downward pressure. And you're going to keep moving in more pressure on the SI joint. So a lot of times I'm not a fan of those until we've actually done the mathematical equation that we do on our x-rays to validate you actually need it. Now, if you're a patient of mine, you're like, I've never seen them do that equation. I don't have to anymore. We have digital computers and x-rays now, and the computers, they do all the work for me. So we have a digital x-ray. We just tell them to do a hip ablation and they'll give me the number. So it's really easy to do today compared to what it used to be. So we don't have to get off the compasses and the protractors and everything and do all of our measurements anymore. Technology has taken that job from us. If you have SI joint pain and you want to get to the bottom of it, don't just go somewhere and have them treat the SI situation. There's often bigger questions. It's usually not just the SI joint. It's usually come a compensation from somewhere else. And you can treat that SI joint all day long, do all kinds of things to it. I've even heard people getting steroid injections into the SI joint, and the whole time they had a neck issue that was causing the problem. So if you feel like you have SI problems, a trip to the chiropractor with a set of x-rays so they can actually measure your pelvis. Now, if you have x-rays from your healthcare provider, you could bring them with you. They just have to be standing upright pelvic analysis, because we don't want to try to analyze your pelvic rotation when you're laying down, because we wouldn't see how gravity affects it. We wouldn't be able to tell if it's a measured difference or anatomical difference because you're not standing up. So we'd have to have you standing up in an x-ray. But if you have a front to back view of your hips and an x-ray, we can measure that for you right away, tell you have a long leg or short leg. Actually, a fun story, when my grandfather was still alive on my mother's side, he had a prosthetic and they kept trying to measure it, tell him it was off. So I had him put it on. I did this x-ray and I was able to give him the exact millimeters, how to change the height of it to level his pelvis off. And he was quite happy after I did that. In fact, the prosthetic place often sent me other people to measure when they were struggling to get it right, and we were able to help them. So go see your chiropractor, have them do a pelvic analysis on you, and then also have them look at the rest of your spine. Because again, I've fixed many SI joints over the years. I never even touched them because I cleared out the rest of the spine. So if you're having SI problems, make sure you follow up with your chiropractor. Hey, thanks for tuning in. And remember, if you have a question about whether you should seek chiropractic care, whether that chiropractic care is good for you, the only person qualified to answer that question is a chiropractor. Nobody else studied chiropractic. If you ask them to do a constant pelvic analysis of you, everybody will look at you with, what are you talking about? You go to any chiropractor, like, oh yeah, no problem, we can do that. So make sure you go see a chiropractor for these things. All right, everybody, thanks for tuning in. Come back next week.